ska jag strax introducera John Halloran, men jag tänkte säga några ord på svenska först, eftersom ni vet det är engelskspråkiga föreläsningar idag. John han företräder den organisation som heter ESN, European Social Network. Och vår alldeles egna Lars-Göran Jansson, ställde upp Lars-Göran, är ordförande i det nätverket. Och, nätverket har funnits i 15 år. Och det är en sammanslutning bestående av ungefär 100 medlemsorganisationer. Och Sveriges Socialchefsförening var en av grundarna av nätverket och har ju varit med hela tiden. Och det ville John särskilt att jag skulle nämna eftersom vi har en stark röst där.
So first of all, the European Social Network, it's an independent network for directors of public social services. And of course, already, depending on the audience, this will mean different things. In some countries, social services are health services. They come under the umbrella of health, or they come under the umbrella of social security. They may be very centralized services run from the ministry directly through subdivisions to the rest of the population, or they may be very decentralized indeed. And there are all kinds of combinations of services. So that's what makes actually the network quite interesting, because there's enormous diversity in policy and practice. We currently have 110 members, the most recent member being the Gothenburg region, I'm delighted to say, in 34 countries. So we have diversified, and that's why when I show you this map, you can see a whole range of public authorities, government organizations that are members of ESN. And what we do, we're a learning organization. We meet in working groups, in seminars, in conferences. We do policy research. We exchange practice between each other. I want to emphasize the role of ESN and your role in helping to empower all our citizens, particularly those who are most disadvantaged. And in our seminars and our working groups, we seek to involve service users and to consult with service users. Because if we're not doing that, then I think our message is certainly missing probably one of the most important elements. When we're talking about social investment, we need to actually interrogate ourselves in the same way as you would if you were making a financial investment, to say, how can we actually get the most effective use of public investment to improve the life chances of our citizens? And evidence is the key. Data is the key. Improved public management is the key. And a much improved relationship between our citizens and our state. I was recently in Portugal, where we have our conference next year, and the director responsible for financing from central government level has said to me that it's not just a question of having more resources, which they would like to have, but it's a question of having the freedom to use those resources in a more strategic way. And the number one problem at the moment is insufficient data. He said, we simply don't know what happens to the money. We assume it's being spent well. We all have our heart in the right place. There are organizations providing services for hundreds of years, but we need to know more about outcomes. We need to have some evidence. And particularly when we look forward into developing new services in new areas, how do we know where we should put our resources? I think there's another area here which I would like to explore, and maybe at another time we could have this conversation, is how our relationship with those to whom we provide the services, our service users, our citizens, how that can become much more of a partnership around social investment. So the question, I think, at the end, for me, is also about governance. Is if we're talking about social investment, who does this belong to? And how can we ensure that together we're producing outcomes that are going to benefit all of us? So I think the language of social investment, undeveloped though it is, offers us an exciting new language. It's up to us to fill in the space. It's up to us to create, if you like, a new way of going forward, which in a sense is almost like a new social contract between our communities, our people, and those of us who work in public services to ensure that we are going to use the experience and the expertise and the knowledge in a way that's going to deliver much more effective services, both directly to the service users to enhance the quality of their lives, and we need to be able to measure that, and also in terms of the way we actually put our services together, whether it's health, social services, education, housing, etc. So with those words, I'd just like to thank you for your attention at this time of the morning, and I'd be very happy if anybody has any questions and we could take it forward. Thank you very much indeed. Thank you.